ordinary states of consciousness with their psychotherapeutic methods. So we're going to open this up. Instead of having it be a talk by the panelists here, we want to have questions from all of you that you are interested in. And then if there's one of the persons you want to direct it to, you can say that, or you can just leave it to whoever is interested in answering that particular question. So if you have any questions, just raise your hand. And we have two people that will walk around with a microphone. And if you just speak into the microphone, then we'll have a discussion. So we're really interested in a more interactive roundtable at this point. So feel free to ask any question that you're interested in. Does anyone have a question about how to use non-ordinary states of consciousness in psychotherapy?
Well, I have a small question for starters, which is, do we actually change consciousness, or do we access consciousness in different degrees? I'm not sure. I would say that we access consciousness. Consciousness is something much more bigger than the personal mind. And consciousness has many, many levels. And so it's like choosing a channel. We choose some levels of consciousness, and then we have access to these levels. And we can switch our attention broader or more narrow. So we can switch it to an understanding of the everyday's reality we are used to, or we can switch it, for example, to the acknowledgement of the wholeness. That's another question.
In terms of working with clients who have been through some kind of spiritual crisis, what is your stand and what is your advice in terms of medication? At times, some of them are still on medication. They have a problem with the idea that they've been put on medication. They could have been in a psychotherapeutic situation for possibly 9 to 10 months, but the mainstream insists that they carry on taking this medication, and they feel as if they are not able to function properly due to the medication, because it tends to be quite downer, and then they're offering uppers in terms of non-depressive pills, etc.
In my vision, I don't treat patient or client, but I enter in a process. And I try to live with this process in a way that respect the process and respect the laws that the process asks. So for me, it's not important if the people is taking medication or not. I think I am, and if I have time now or in my presentation Saturday, I think in my way I have some criteria to recognize if the process is flowing, if the process is in resonance with the field, or the process is blocked. And this is for me a guide to work with the people. But I don't work with client, I work with the field that creates into me and the client.
Okay, I would like to say something in addition to what you just said, is that we can consider that working with non-ordinary states of consciousness is somehow contradictory with taking a suppressive medication. However, it happens sometimes that people, want to work with, let's say, holotropic breathwork, which is what I work with, and they take antidepressant or any kind of psychiatric treatment. And we had experiences, not only myself, but other people, and especially colleagues who are psychiatrists, that it is possible to do this work with this type of medication. Even if, from the first point of view, it seems not to be on the same track. And what I observe sometimes is that, it can, it changes the process because, there is a suppressive effect of this medication. But, each person has his or her own process. And it's not from outside that we have to judge if it's deep enough or not. So it's, their own path, and this is okay. So we considered, and it was very valuable for these people. And I work with a friend, and with Bridget, who is here, and we work with a very close friend who was psychiatrist. He died some years ago. And they had quite a big experience with this type of people, and it was very, very, very effective for them, even if they were taking a medication. So this is, from our experience that I
Аз също бих искал да допълня, тъй като аз съм лекар и много пациентите, които идват при мен са с някакво медикаментозно лечение. Не влизам никога в конфликт с това, което са предписали колегите психиатри, но това е един бавен процес, в който постепенно, работейки върху симптомите, работейки върху осъзнаването на проблема, ние намаляваме лекарствата, ако е възможно. Също така комбинирам, и това е възможно с мои колеги и с моите знания по хомеопатия, по натуропатия, които да заместват силното блокиращо влияние на лекарствата, на фармакотерапията. Така че мисля, че не става дума за някакъв конфликт между медикаментозното лечение и методите на трансперсоналната психология. Става дума за една декларация, за една съвместна работа.
I think without medication and with medication, for example, if somebody is in a psychotic-like state or in a state of spiritual emergency, it's a matter of contact. What's my experience? I have experienced working with a process with medication and without medication, but the main thing is how is my personal relationship to this person. And if this relationship is stable, then it will be possible that I can accompany the person in very deep altered states. If this person is not stable, then it doesn't work without and with medication.
I have a friend in Norway who has a diagnosis of paranoid schizophrenia. he has access to past lives experiences. He has been he's been forcefully admitted into mental hospitals. He has been forcefully medicated. He has taken his way out of all of that because he himself felt medication just locked him into a state of mind. It is my feeling that perhaps the medication may open up for existential deep feelings and questions, and it locks you there when people want to commit suicide because they all of a sudden have started on the medication, or maybe not all of a sudden. And in order to take your way through a process like that, one needs time. And I find it very curious that we do not ask the people or listen to the people who say they don't want to be on medication, yet they are forced on medication. It's my feeling through my own spiritual practice that there is only life energy that can truly heal. Medication doesn't do it for you. So I think one should do some more listening to those who are saying they don't want to be on medication. Thank you.
Just related to what you say, I think one of the conflicts that I've seen in transpersonal psychology is when there seems to be a differentiation between the spiritual process and psychoses. And I think as long as the field keeps doing that, which is different than what you said, then this whole medication is going to become a continuing reality. So my question is, why do we do that? Why do we differentiate between the spiritual experience and psychoses?
I would like just tell a little story. In '82, I was working in the psychiatric hospital, and I felt very bad. And in July, I went to the Brazil for the first time. At that time, I was a medical doctor, communist, and materialist. And come out, sitting. I went to the Brazil, and briefly, in a week, I went in a clinic. This doctor, Eliezer Caramendes, worked with psychotic, epileptic, addicted, all that was for 20 years in sanitarium. And we took out all the medicaments and just and drumming and chanting and working with the drums. And I stayed in this community for many periods in the last years. And I learned so much in this place. And he says that all are in our madness, and all is free to live this madness. And there was a unique place where I saw some psychotic go out definitively for their psychosis.
I'd like to say something here too, because like David Lukov, I've done a lot of work with people with spiritual emergence, and I also helped to co-found a psychiatric facility for people who were in hospitals that were labeled schizophrenic and psychotic. One of the things I see about the transpersonal approach or transpersonal psychology is how is the paradigm of how we view illness, how we see these things. Psychology in the past has pretty much seen a lot of what we experience, we talk about here as pathological. And the expert, quote unquote, who's working with any client or patient brings a certain manifestation to that relationship. If I see what you're doing as being pathological, it's going to have an effect. It's going to have some kind of a manifestation. If I bring that you're on a journey or a process, and I don't mean to deny the fact that there are people that are going through psychotic process, there are also people who are going through spiritual emergencies that are not psychotic. But what's important is how we hold that person that we're working with. And with this psychiatric facility, we never labeled any of the clients. We never brought the pathological viewpoint to them. We saw them as people who were having difficulty making it in life. And what could we bring to their growth, their journey, as opposed to just trying to cure them? And that slight shift in consciousness about how we viewed the clients that we were working with and what they were going through made a big difference. It was more like, okay, like what Pierre Luigi was saying. If you're choosing to be in that mode of mind, let's say you're choosing a psychotic way of life, how can you function from that place in society? Rather than locking them away, rather than giving them just medication, how can they function also from where they are? And I think that's a really important thing on the spiritual path, that you have to acknowledge where you are before you can move forward. And by locking people up in a hospital, by giving just medication and never adjusting that, it locks somebody in a position. And transpersonal is about expanding consciousness, not suppressing consciousness. So I think it's very important, how we view this, how we view what we're talking about as psychosis, about spiritual emergence, about spiritual emergencies, and to honor the non-ordinary states of consciousness as something that's beneficial also.
Two things to take this, what you are saying. The process of a person who is in an emergency and of the therapist who is accompanying this, it's a common process. And it's dependent on the field where this process takes place. It's a very big difference if this place is, for example, in psychiatry, a hospital, or a workshop, or it is in the Amazon, in the rainforest. So the field in which this process takes place makes the difference in the behavior of the therapist and of the person who is in the emergency. Then the other thing is, when we are, for example, in a therapeutic practice, then diagnosis or medication mostly is a protection against the anxiety of the therapist. Because what happens, for example, if somebody is getting psychotic, this means that the therapist is not able to communicate with this person. And mostly, when I look at myself, my boundaries are when I'm getting furious on this person, or when I'm getting afraid of it. Then I have to say, okay, then it's not possible for me to go further with her or with him. And in psychiatric way, I could say, now it's starting getting psychotic, so you have to get medication. So you have the choice. But the main thing is the field in which a process takes place. And if this field is a safe container, a lot of processes diagnosed in a psychiatric way as psychotic could be accompanied in the process of growing and a change in consciousness.
Just a quick story to embellish just what you're talking about. About 30 years ago, I took a lot of psychedelic mushrooms, and I was by myself in my house in California. And I took far too many, and I went into a terrible psychotic state. And I was sort of lying on the floor alone. And I thought, that this is the end. Luckily, my guardian angels were on hand, and the front door rang, and sort of with no clothes on, an insane sort of mood, I went and answered it. And there was a wonderful friend of mine who happened to have with her a friend who worked with people on psychedelic journeys. And what they did with me, they just arrived, and they stood and they hugged me for 4 hours. And I was completely able to move out of that psychotic place. And the whole experience was enormously transformational. And I was completely all right, which somehow sort of revealed to me that if an energy from a higher state of consciousness or a loving heart energy is present, then that of itself, that graced energy, is able to affect the transformation and allow your energy to move. However, the problem is that most psychotherapists don't have 4 hours to spend, sort of hugging their clients, and they might get a, professionally sort of, cut off from doing that. But it does seem to me as if we need structures that will allow a loving, healing, transformational energy to come in. And, I thank my angels or whoever organized that. But certainly I was thinking to myself, unless I'm given some suppressant medication mighty quickly, I'm going into terrible places that I simply cannot face because it was about to become too much for me.
So, now let me play the devil's advocate and protect a little bit my psychiatrist friends. So, first one, if you have a cardiac arrest suddenly out of the street, which one do you prefer to call? A healer or a medical doctor?
I would call a healer.
Then you are dead. Probably the healer will not be able to cut you open and manage your heart because there is a blood clot blocking everything. Then, the next thing is, in the past I witnessed a situation where a young boy was catatonic in the hospital. And he was so catatonic that he wasn't answering any question and he wasn't moving any muscle for days. So his body started to rotten. And all sorts of medications were tried out with no results. nobody could talk to him. And then they resorted to electroshock therapy, and it worked. Of course, after, I know he was in lots of antipsychotic drugs, and I think his career was over probably because of that. But at that moment, to make sure that he would stay alive, it looked like there was no other way. Eventually, perhaps in a different situation, there would be another way. Also, there are some situations, rare, but extreme situations, of acute maniac episodes, where the person starts jumping and crying and running around. So you cannot relax the person, you cannot talk to the person, and even the available medication will not work. The thing that will stop this is electroshock. If you don't stop this, the person dies after a few hours with a cardiac arrest. This to tell that there are extremes of what we can do. Sometimes we must be careful to still pay attention to medical doctors. And even medication, I have known some psychiatrists that when they are dealing with patients with close to extreme situations of spiritual emergency, they use small doses of antipsychotic doses to slow down the process a little bit, so that the person can grasp it a little and then deal with it in a spiritual way. And that was my comment.
I want to say shortly to this. It's very dangerous to get into a fight with these things and to create opposites. I think it's a matter of cooperation, it's a matter of empathy, and not to getting into a fight with these things.
You know, we talked about with duality this morning, and with Rainer, you know, the two sides of something, and so this is how our world works. You know, do you do something right, or is it right, or is it wrong, and is it the best way, is it the wrong way? And I think that in the transpersonal vision, we should try to open, you know, the doors to several possibilities, and not to make opposition between doing this or doing that. And of course, we need everything. We need medical doctors. We need healers. It depends. And also, even if we are all trained in transpersonal methods, we live in a world that is not exactly, you know, on the same vision, on the same functioning mode. And we cannot work against this world. I mean, in my country, if I would try, you know, to impose a certain understanding of what is the right answer in spiritual emergency, for example, you know, I would be very quickly put aside, and I would never have a chance to be listened. So we have to find more cooperation, more you know, twinning our different solutions, or etc. etc. So this is just what I want to say. Not try to make opposition between you know, these different words, I say, or visions.
For me, the problem does not exist. In my work, I think all the therapists answer to a question. If a question is medicine, I say no, because I don't trust in this, but if the people want medicine, can have medicine. I think that is more a problem for the therapist than the client. I think I have to stay more in to have not project for our client and just answer to a question. I have to say, you talk about catatonic. In this experience I said in Brazil, my first experience was I entered in this meditation room and they took the catatonic in the middle of this catatonic went to the hospital that was 2 months catatonic. They put the catatonic in the middle. They call a sensitive psychic around that they started to express all entered in the field of the catatonic. They started to express the angry and so on, and then the catatonic go out to the catatonic, and that night was playing card with us. In this moment was born biotransenergetics.
I'd like to make just one quick comment, because I think Frido brings up a good question. Is that, yes, when I severed my Achilles tendon, I went to a doctor, obviously. I didn't sit there and just meditate or chant. But I did use acupressure, and I did call on spirit to cut away the pain. And there was absolutely no pain when I went to the doctor. It would surprise them. We all know that some medical things save lives, some destroys lives. We know psychotherapy can be beneficial and not beneficial. It can be harmful. I think the purpose of transpersonal psychology is to do research on these non-ordinary states that don't sound very rational, don't sound like they could be valid, to show that there is some benefit. So what I'd like to do, if I could, is to shift a little bit the questioning to, we have these experts that use non-ordinary states of consciousness in their psychotherapeutic methods and practice. Let's ask some questions about what they see, how they use those methods or those states of consciousness, what have they learned from it, what have they seen the benefits of it, because I think that's really important. That, it's a really important question. Do these non-ordinary states actually help people? So, we have a question.
Yes, sorry, I'm not quite answering that because I'm a little bit behind. Is this working? Yeah. But on this thing about catatonic, I was just reminded of a story about Ronnie Lang. Ronnie Lang visited a hospital, and they said, we have this guy who's completely catatonic, and we're thinking of giving him electroshock treatment. But let's see what you can do with him. So this guy was sitting with no clothes on in the middle of the floor, and Ronnie Lang went to him, took his clothes off, sat next to him in the same position that this guy was sitting. And then this guy moved a hand, and Lang moved his hand just the same. And the guy moved his foot, and Ronnie Lang moved his foot just the same. And then the guy turned his head, and Ronnie Lang turned his head. It became like a kind of little dance. And at a certain point, this guy started laughing. And he came out of his category. And I just wanted to give you that example.
I have a question about the statement, non-ordinary state of consciousness. It looks like that it not so good corresponding with our understanding about this point, because we are gathering and we're practicing different types of meditation, holotropic breathing and other things. And when we get in this state of consciousness which are beyond our ego or fear, then we understand that these states are more ordinary for us than the states we stay most time of our life. That's why maybe we have to change the statement and we have to call them ordinary states of consciousness of being, because they are more ordinary than non-ordinary. This question has two statements. First is our message to the whole world. This is our professional message to our other world, other professionals, that we treat these states of consciousness like artificial. And the second part is that we send this message to our subconsciousness, that these states of consciousness are artificial, so we must force ourselves to get in the states. We must do something artificial to feel what are we feeling. So this is my opinion about this, because it becomes like official statement of the Eurotas in the documents, in the speeches we heard yesterday and we heard today. With so many times we use this statement. Thank you.
It reminds me of stories Stancroft told once. Stancroft told that he offered LSD to Muktananda. And then Muktananda tried it, and then he said, oh yeah, and then asked him what happened. And Muktananda said, oh, not anything, it is the state where I'm always in. So, but it depends also from the state we are always in. Yeah. Yes, you're right. Since in a sense, transpersonal psychology and psychotherapy is rediscovering what was psychotherapy for 1,000 years, since shamanic time. If we ask the questions, what was psychotherapy before psychotherapy, which means before Freud? Yeah? Somehow people were doing this psychological problem for centuries. Yeah? And this was primordial psychotherapy. Yeah? This was a psychotherapy that were using non-ordinary states in shamanic time, and shamanic were relating to nature. And for many years, I practiced with a group of folk singers who are great in Slavic rituals, so-called Slavic psychotherapy. Likewise, today in the morning, Stephen and Pierre Luigi were doing shamanic cycle. We were doing Slavic rituals, Slavic singing, Slavic dancing, Slavic cycle, and people were healed. Since they were transcending the limits created by ordinary life, so to say. It was Chogyam Trungpa who said that Western people are living in the state of neurosis, since they believed that the picture created by ego is reality. And this is the source of both non-ordinary reality and I think 90% of our psychological problem is and dysfunction. So in a sense, transpersonal psychology, psychotherapy is rediscovering primordial psychotherapy. So you're right, there is no non-ordinary in non-ordinary states. This sounds very great for me. There's a very deep truth in it, but there's an alternative view on it. When you ask the question, what happened before Freud, you could say, what is psychotherapy before Freud? You also could say, it was the church who did, the Catholic Church who did psychotherapy for people. And this also felt very normal for people at that time.
Yes, it depends where we put the boundary, because if you go before the church, there was the shamanism, but we have to remember that dreaming work was in the time of the shamanism, hypnosis, dancing, chanting, and all healing, all the practice of the psychotherapy, there were already in the shamanism. But this is one. The other is a non-ordinary state of consciousness. It's completely, I agree totally. I never liked the term non-ordinary state of consciousness, and worse, altered state of consciousness. I think that there are just states of consciousness, and we have to do like the Native Americans say, we have to have able to dance in all positions of the wheel. This is the state of consciousness, to be able to move and to enter in all states of consciousness, and it's just a statistics concept, non-ordinary but ordinary. So you have, I think you have to erase this term for transpersonal and just speak of state of consciousness or enhanced state of consciousness. But I agree with you.
I just want to say something. I agree with what you said, Luigi. And once again, non-ordinary or ordinary states of consciousness create the duality, make opposition between two states of consciousness. And I prefer to see things as a continuity. And that's why I prefer the expression expanding or enhanced states of consciousness, which means that it includes also what we say usually the ordinary state of consciousness. It's just kind of continuity, and it's part of our personal evolution to access, to open the state of consciousness more and more. It's not we go there or we go there. It's just a process, and I like to see that in sort of continuity of a wheel, as you said.
Yeah, but also we have to ask the question: what is beyond consciousness? What is beyond consciousness? Like the sensing is: did you look in your face beyond your birth? And what is beyond consciousness?
Искам малко да върна темата към терапевтичната част на изменените състояния на съзнанието. По-голямата част ние говорим за тежките психотични състояния и за ефекта от изменените състояния на съзнанието върху тези психози. Мисля, че много хора страдат от така наречена нормална невротичност. Много от нашите близки, познати, колеги дори приемат и провеждат фармакотерапия за невротичност, безпокойство, напрегнатост или пък за безсъние. Необичайните състояния на съзнанието могат да бъдат полезни на 100% при тези състояния. И мисля, че ако в тази насока ние сме по-настоятелни и без притеснение и без притеснение настояваме да се замени фармакотерапията с методи, които включват изменените състояния на съзнанието. Много по-лесно, по-късно можем да вкараме да използваме изменените състояния при по-тежките диагнози, по-тежките психиатрични състояния.
In my shamanic practice, I teach people how to journey. And what I mean by that is they shift their consciousness so part of their soul goes to a spirit realm and connect with spirit entities. Now, in the diagnostic manual, there's categories for that: dissociative, hallucinatory. And what I found is that this isn't necessarily true, that people can actually shift their consciousness and go and touch realities different than the one we're existing in right now. When you mentioned about ordinary, what I teach people is how to, as Bernadette said, expand their consciousness to not limit themselves to what is ordinary for them. The thinking there are no spirits, there's no way they can connect with spirits, that all there is the material world. What I'm doing is showing a form of consciousness or a form of reality, if you will, that is not ordinary for them. Now, I agree with you. For me, connecting with spirits is very ordinary. It's a part of life. It's been, as long as shamanism has been around. It's very old. It's I think, a necessary part of life, and it's really added to my mental health. It's very important. Now, Linda talked about, not to make a separation here, because I see it also as a continuum. The more that I've journeyed, and the more my clients journey, the more they know what is the ordinary consciousness, how to get by in their everyday life, and also how to connect with spirit. They don't confuse the two. Oftentimes in a psychotic state, as David mentioned earlier, when he thought he was the reincarnation of Christ, he thought he was the reincarnation of Buddha, he didn't know the difference between the two realities, those two forms of well, what I'm saying is that he thought he actually was the Christ and was the Buddha, as opposed to he was connecting with the archetype within himself.
No, but this is a good question. Who was he really when he thought, I'm Jesus? Is it true?
He was David.
I'm Jesus, am I true or am I not true?
Well, yeah, he was true in the moment. What I'm saying is that if he says he's Jesus and no one else is, that's not true, because we all are Jesus.
Yeah, this is the answer. It is true that he was Jesus, but the mistake was that he thought he's alone Jesus.
Yeah. So, it's just, hopefully transpersonal psychology will bring about all these things to be ordinary states. But as you all know, it's not necessarily ordinary for everybody at this point.
Хотел бы спросить, если мы говорим о трансперсональном подходе, о некотором многообразии, в том числе опыта и предельных состояний, которые дают опять-таки это многообразие, которые испытывает так или иначе человек. Откуда, в общем-то, мы берем тогда в результате проблемы этого самого человека, насколько они проблемы этого человека, его сознания, или это проблема вот этого всего многообразия?
Can you translate your question, Alexei? For English, yeah, since it wasn't translated.
If transpersonal we have many different consciousness and so on, objects, processes, and so on in the universe, then we decide that one man or woman is all of it, all of them, and all of them is one person, for example, and from what we get one person? One person's problems, one person's consciousness, and so on. Maybe only this universe and its problem, not one person's problem.
Вече сме към края на нашата дискусия и аз думата на нашите лектори да приключат с темата, да кажат.
Владимир, может быть, просто если вот это многообразие предельного опыта мы имеем,
As far as I understand, Alexei, I'm trying to keep him both on Russian and on English, and I'm not still sure that I understand him right. The question was about the source of our problem. Where is the source in person, in nation, on Earth, or in the nature of universe? Am I right?
Yes, and where is the man?
The nature of...
Где этот самый человек? Может быть, тут проблема-то не человека, если это все вокруг многообразия. А мы его лечим, мы его пока еще не нашли.
Of course, in a sense, you are right, and the process of opening and spiritual growth is connected with going into the depth and into the cosmos. It's the truth of deep psychological exploration. And on some level, we are working with personal problems, so to say. We can recognize as belonging to us, to our life. And on some level, on another level, we are working with transpersonal problems, national problem, with kind of religious archetypes, and we had to find answers on this kind of eternal primordial questions. And on another level, of course, we had to work with kind of cosmic ultimate issues related with the nature of evil, with issues connected with death and rebirth and so on. So it's an infinite journey, so to say. Yeah, please.
There's one question open. I think we didn't talk about this. What is beyond consciousness? What is the source of consciousness?
Do you have your own reply on this question?
Oh yeah. For example, Ramana Maharshi said, look in your deep dreamless sleep. Then you know what is beyond consciousness. Are you there when you slept very deeply and when you didn't dream? Yes, of course you are there, but you weren't conscious of this. So what is beyond consciousness? And I think this is the source of everything. But it's an open question for all of us.
I think it is not an open question. For me, because I think that somewhere there are the truth. And each of us can reach the truth at the step it can go. So the consciousness for all of us is something that you can experience. So the difference is not in an intellectual question, but is in the place where we can arrive or we can get. Because in the history you have all the perennial philosophy that says what is the consciousness, but you have to experience and arrive to say, yes, like I go in the mountain. How is the top of the Everest? I don't know, I have to go there, and when I go there I say, yes. It's like they wrote in the books. So I think the difference is into the experience, not in the idea.
So we have time for just a few more questions. Okay, we can take one more question.
Excuse me, my name is Adriana Botello, astrologer and psychology, and I would like to tell you two things. First, one kind of information. Tomorrow at 12 at midnight, there will be the autumn equinox, and everybody are welcome in the circle all together in front of the hotel, between the sea and the trees. a very important action to unite the human conscience, earth conscience, and maybe other conscience. So we're thinking about what is beyond the conscience. The thing is that I think that we live in some kind of alchemical process of interference between the conscience of the human being, earth being, as we know, maybe the noosphere of Vernadsky about this person, and the conscience of the earth, and the conscience, of the computer. Everybody knows maybe that 80% of us is a liquid crystal. The most percentage of this earth is a liquid crystal, and the most processes in computers are liquid crystals. So it's absolutely logically, and not only astrologically, that this process will be increased in the further years, and that's why maybe the role of the transpersonal psychology and psychology will be increased too. It's simply logic. Thank you.
Okay, so I'm not sure this is really a question, but it's more of a synthesis of what I heard, and a question about medication and my experience when it comes to dealing with using medication or not using medication. In my own experience with clients and my own journey, I think the problem is not one of take medication or not medication, but one of deep listening to what is relevant at any particular time. I think for me, the beauty of transpersonal is having the personal and the trans. And for me, if everything is divine expression of source, then medication is definitely channeled and an expression of source as well. So I don't differentiate with that. I think it scares me to sometimes hear a split in transpersonal, ordinary, non-ordinary. I heard the word continuum, and absolutely I see it as a continuum. And also in terms of medication, the way I look at it is just like there are different developmental stages. And there's certain developmental stages that just need more holding and more containing. I think it's really important as, I'm not going to say therapist, client, healer, but as a space holder, whether it's a shamanic space holder, it's to do deep listening, because I've seen a lot of, I've seen the good, the bad, and the ugly of many professions, of psychotherapy, of shamanism, of using psychotropic drugs. I think it's a matter of deep listening and the kind of space that is held that makes all the difference. And I know that in many surveys in the United States, I don't think you may be able to help me, but there was a survey of interviewing just different modalities of psychotherapy, and what they found, at least in psychotherapeutic language, is that what really mattered was the rapport. I call it the space that has been held, and it's a space of integrity and of deep listening, because it scares me to also hear. I had a client come to me the other day, and she said, my acupuncturist said I should absolutely stop my she was taking antidepressants. And I was like, it's not about stopping or starting antidepressants. Like, let's listening to what's happening now. At some stage, this woman could not sleep, so maybe it was very applicable for her to take some form of medication. Now, even on her own continuum, it's coming with an open space and deep listening. And so I guess I just want to set my intention for what I hold for transpersonal psychology and for everything, for medicine and everything, is for to really heal that split. And I just want to refer back to, I know I'm going on maybe a little bit on a tangent, but I just want to kind of, sitting in that circle today, and was it Tana's circle? For me, it was like, yeah, coming full circle, seeing the yin and the yang, the feminine and the masculine. It's like it all has space. And to allow for that coming together, not to feed the split. So thank you.
Правда, еще последний вопрос, который дискутирует наша круглая масса, искренне благодаря нашим участницам. беше много интересна тази дискусия. Надявам се, че и на вас. С това закривам днешната кръгла маса. И след това искам да ви съобщя няколко съобщения технически. Едно от което е, тъй като днес малко нарушихме графика, както виждате, закъсняваме с 1 час. Моля всеки един от вас да наблюдава програмата и да бъде 5 минути преди или поне на време да бъде в залата, която трябва, където иска да посети, лекцията, която иска да посети или семинара. Другото съобщение е, че има... Окей. Следващото съобщение е, че обяда за всички е тук на втория етаж. Значи, ние сме партия тук и на първия етаж, и на следващия етаж, отдясно, когато си лечите по стълбите. Пътеката ще ви доведе до ресторанта. От днес до неделя обяда ще бъде за всички там. Закуската ще бъде в хотелите, всеки където е настанен. Също така, тъй като възникна, няколко души попитаха за купуване на телефонни карти, може да закупите такива и има на регистрация, може да купите и да вземете. И още едно съобщение.
Yeah, I just wanted to make an announcement that there was supposed to be some discussion on the DaisyNet network. Because of time, that won't be happening right now. But if you are interested in the DaisyNet network, and if you look for anyone that has this card, you can ask them about it. Yeah, you should go there. And it is connected with Eurotas. It's on the Eurotas website. If you want to connect with the streaming of this conference, you just go onto the Eurotas website, look for the DaisyNet, and it'll take you to the streaming. So, thank you.